Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through November 18th, 2021. As I've done in previous weeks, I'm going to try to cover the news of the week in 3 minutes, and this week I'm just going to cover one topic, which is what is the status of the pandemic at age 2? Many people don't realize that the earliest diagnosed case in retrospect was in November 17th, 2019. So in fact, as of yesterday, the pandemic is 2 years old. So let's take a look. I'm going to start the timer. Let's take a look at where the pandemic is at age 2. Worldwide, you can see this steady rate of growth, now over 5 million deaths. But what we're seeing is this undulating pattern, up and down, up and down. And of course, you can see an increase in cases recently globally. What's perplexing about this is that the peaks are not equal distant between them, either globally or in individual countries. In terms of deaths, which is a statistic we tend to follow, you can see the same pattern. We're not yet seeing an increase in deaths worldwide, but we anticipate that it will. Not only are we seeing this change in the pandemic in time, we're seeing a change in where it's located. And I should mention that even though this is down quite a bit from the peak, it still represents about 7,000 deaths a day. In terms of where it's occurring, you remember that early on it occurred in Europe, and then in the first summer it was largely in the Americas. That first spike was made up of Europe and the Americas. The second spike, Europe, Americas, and now Asia. This third spike, again, mostly Asia and the Americas, but now you can see that it's reoccurring in Europe. So it has this pattern of undulating both in time and in place. In the US, we've had almost 800,000 deaths, and you can see that it hasn't been even, and that's the same idea, this fluctuating pattern. We are seeing an increase in the number of cases, but we're not yet seeing an increase in the number of deaths. But even at that, it's still about 1,000 deaths a day. You can pause the video if you wish at this point and see the cumulative deaths per million in your state. And these numbers are so much higher than when we first began. But you can also see there's a pretty significant difference between states, and there's Tennessee there. Not only, of course, again, it's not just how much, but where, when, and how it's occurring. In the last week, you can see most of the cases are occurring in this upper Midwest region. You remember in the early part of the year, it was really burning hot here in the Southeast, and then it sort of moved up. Now it may be creeping back. We'll have to keep an eye on that. But the one thing that we're clearly seeing is if you compare vaccination rates with deaths in the last 2 weeks. So how many people are dying in a state based on their vaccination rate? In the past 2 weeks, the average death rate for the 10 most vaccinated states was 0.21 deaths per 100,000. Compared to the 10 least vaccinated states, it was 2.5 times higher. So where is the pandemic at age 2? It's still burning around the world. We're seeing an increase in cases both globally and in the United States. We're not yet seeing an increase in deaths, but clearly the very best strategy we have right now to stop the pandemic is vaccination rates. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let me know. As always, I'd like to thank Derry Young for editing, producing, and posting this video. If you have any questions or any topics you'd like to see us address, please let me know. I look forward to hearing from you. Until next week, please be well. Thank you very much.